founder and CEO of SAMI. It's a company that's dedicated to preventing mixed diagnosis and improving care for people with chronic lung disease. You'll hear from Maria. She participates in a ton of D by D things, so I've heard her fabulous story. I have seen her do pitching. I mean, she is a powerhouse woman. She was trained as both a scientist and a translational physician at Harvard and UC Berkeley. She shifted into from her surgical career that she had to entrepreneurship after the loss of her grandmother, who struggled with COPD, inspired the creation of SAMI, which is named for the Quechua word meaning to breathe deeply. As an accomplished innovator, Maria has co-led NIH Gates funded projects, published in leading journals such as NEJM and Nature, and secured millions in research awards, investment funding. Her work integrates lung physiology, the Internet of Things sensors, and AI to transform home monitoring and empower patients and physicians alike. She is absolutely driven by passion for solving complex problems and advancing health equity. So, Maria, as a fearless leader, I welcome you to do your presentation.
Oh, thanks so much for the invitation, everyone. Thank you for spending time here. So, my name is Maria Artunduaga. I'm a physician scientist. I'm the 2024 medtech innovator global winner, and I lead a team of 20 people in Samai. We are also Colombia's best startup. We are co-located in the Bay Area and Medellin, Colombia. This is where the picture was taken, by the way. And we are working towards transforming respiratory care for 500 million people that are living with COPD in worldwide. The story goes with my grandmother. So I'm going to tell you a little bit about the company that we are building. So my grandmother, my abuela Sylvia, she had COPD, and unfortunately she passed from it. She couldn't have access to simple tools to understand her pulmonary function. And her story when she passed obviously revealed a strong crisis, a global crisis. 500 million people have that disease. I don't know if you have learned about it. It's called chronic obstructive pulmonary disease, usually late night ads. A lot of people, like I see, our seniors, they're usually using oxygen, and 80% of them don't even have a diagnosis confirmed. It leads to about 3 to 4 million deaths annually and about 70 billion, 143 billion dollars in expenses every single year. We have a technology that we've been working on for the past 6 to 7 years. We've raised a lot of money from SBI grants, about 3 million, and 2.3 in additional money from investors, a lot of angels, a lot of physicians in my network. What we can do, we have a wearable device that goes on the chest. It uses sound. It senses through the chest, similarly to hearing and listening to the sound of a drum. And by using that resonance of the drum, we can understand what is going on inside of the lung. We actually give you numbers for pulmonary function to make decisions, to make diagnosis. And our accuracy numbers, that's how we call it, are between 82 to 93%. A lot of the other things that I can tell you later. For this particular presentation, I actually wanted to make it very personal. I'm going to tell you a little bit more about like my whole journey from the beginning of everything back in Colombia, through obviously my company. I'm Colombian, as you can notice, I have an accent. I'm the oldest daughter of two physicians. I was the best student from my state, top 10 in Colombia. I decided to get into medicine because I assumed that that was expected from me, right? To continue the family business. I went to Colombia Stop Medical School, but unfortunately for several times, I wanted to quit. I felt suffocated with this endless memorization process. There was no room to question. It was very old school, rigid. It really crushed my creativity, and that's something that actually I thrive on. Um, and in my final year, I didn't know what to do. I ended up doing an elective rotation in plastic surgery at Colombia's military hospital. So you can imagine. Obviously, as you know, we have an armed conflict. It was ongoing. It was very, very tough. But I saw a lot of things, very interesting things in reconstructive surgery. I actually ended up developing that path into reconstructive surgery and spent about a year here in the US rotating through different hospitals. That's where I met Dr. John Mulliken. I mean, he's not pictured here, but he was my inspiration to actually become a plastic surgeon. He was awesome. He wasn't just super skillful with his hands, but more importantly, he was a surgeon scientist, something that I've never experienced or witnessed in Colombia because we don't have money to do research. We literally spend most of our money into taking care of social issues and of course, the war. I returned to Colombia determined to make that happen. At the time, Harvard had an opportunity to do a research project, no salary whatsoever, because I didn't have experience. So for about 3 years, I worked in emergency rooms as a general physician, saving every single peso or dollar in our case, well, in Colombia. And I finally made it to Harvard, and I spent about 40 years working on human genetics. I published at top journals, New England Journal of Medicine included, for example, Nature. Won a lot of awards. One of my proudest things to say is that actually I was given a green card under a national interest waiver as an alien. I'm an alien of extraordinary abilities under 4 years, and a $30,000 fellowship. And this is where it gets very interesting. I got matched into a plastic surgery program. So I was the first woman from Latin American school to get into an integrated accelerated program in the history of the US, in fact. But unfortunately, after I had thought that everything was possible and I had, reached my dream, I faced discrimination. So for the first few months, I faced unequal treatment, tons of microaggressions, a lot of questioning about my background, my credentials, if I was part of a minority quota to my face most of the time. In fact, I ended up I discovered that I was actually getting behind everybody else. I was being offered fewer surgical opportunities than my peers. Third response, I complained about it, of course, and I was actually forced into probation, given coordinated negative evaluations, and ultimately terminated from the program. So that's a boo-boo part of history. That was back in 2011. Fortunately, I've recovered from that. It's been obviously a very, very long time. But what I learned from Chicago wasn't just about discrimination. It was actually about reinvention. And that's why I tell people that, every failure is actually a new opportunity to do things that are probably even better. So yeah, I mean, after being terminated, clinical medicine, of course, was off the table. I was very traumatized with that experience. I discovered that when there is a system that rejects you and you don't really have to accept the verdict. So I actually ended up doing something completely different from clinical medicine. My mom especially, I remember she was very upset with that decision. She wouldn't talk to me for about a year because I was sort of like a disgrace for her and her family. She actually didn't talk about me for a couple of years until obviously I started doing things. So what I did was that I ended up doing a master's in public health at University of Washington, and another one, I think Bernard's here, translational medicine. Go go Bears. UC Berkeley and UCSF. And in last year we became the first company from Latin America to actually get accepted into medtech innovator, the world's most competitive accelerator in medical devices, and we actually won. We beat 63 other companies. And that was awesome. That was awesome. And one of the things that I've learned over the past couple of years, especially since I started doing innovation and entrepreneurship, is that these mentors that I found after Chicago taught me to operate systematically. They connected me to the right partners, and they taught me how to actually ask for help, to ask for things shamelessly. So, for example, when traditional fundraising is failing, they have showed me alternative paths to save the company in many occasions. uh Entrepreneurship is very, very hard. You're most of the time sort of like running out of funding and resources. So this is sort of like adversity 2.1 or something like that. And but it's thanks to mentorship that mentorship has become the foundation of everything that I've built. So in terms of like mentorship too, I'm going to show you a couple of examples of the people that I've been mentoring in my company for the past probably few years, well, 2 years or so. So lessons learned for me, all the experiences that I've lived, discrimination, a broken system, rules that don't really work for a migrant like Latina woman, have shaped the leader that I'm now. I lead a deep tech company, means that operating in this unknown with real stakes, and a few places that let you do that in real. There are very few places that let you do that in real time. So my leadership style is built on normalizing feedback as learning, not failure. So every rejection becomes actually a lesson. Every negotiation with anybody, investors, business partners, it turns into a masterclass in resilience and strategy. I usually tell people that I won't give up until I get a yes. So, but on the other hand, part of this, lessons that I've learned over the past few years is that I'm not perfect, that I have flaws and I struggle with a lot of things. But I'm trying to create a space in the company for people that, can take risks, that they see failure actually as a success, and to grow fast while we thrive together building this company. So one of the most interesting cases that I've had is actually Monica. She spent with me only 7 months. 7 months, and actually she got an offer that doubled her salary, so that's why she's not working with us anymore. And she wanted to do more work on pharmaceuticals anyway. But it was very interesting. I interviewed her back in January. She was very shy, very verbose. Her interview wasn't great. One of the things that she was telling me, at least during her exit interview, is that academia didn't let her grow, and as a woman, she understood very early on that she was never considered or seen as a leader, right? But I told her, working side by side with her, that she needed to be extremely ambitious and tackling challenges every day without losing calm. And that's one of the main things that she learned from working with me. There is another case. This is Marco. He came from academia. He was very comfortable, obviously, at academia, giving classes, etc., etc. But with him, what we were working on more on, like, the impact of his work, creating products, going fast, the startup mentality mindset, sprints of about 2 weeks, and pushing him to do more work, being more efficient, and without having to be perfect at everything that he was trying to do. This is something that we work with him uh, a lot. With Laura was interesting as well. She was a biomedical engineer. She was very young. She wanted to actually become a business person. So we worked with her, and I told sort of like create a specific roadmap to make her, clinical affairs type of person who would be good at clinical trial design and management, obviously all things from racing and business development. She got into an MBA at Hopkins this year, so we are obviously, very happy for her. Jose was another person. He also spent just about 6 months. I don't know, my company, everybody gets poached or they do great things after Samai. He actually ended up getting into a PhD at Case Western. Same thing with him, pushing through, a lot of the struggles, don't self-doubt yourself, just go getter mentality, and obviously getting things done quickly, and especially, creativity is something that we work a lot on the company. So yeah, finally, mentoring, what it means to us, isn't passive. It's finding people who see your potential and having the courage to act before you feel ready. What I've learned: don't chase prestige, for example, or other values. For example, I chose Chicago for the name. At the end, what I should have known better is that, I needed to find a cultural fit. And for example, I was the only Latina in the entire department of surgery. That should have told me more about, the culture of the department. And I didn't realize that I was young and naive. Anyway, so the other thing is, like, find sponsors and mentors who actually open doors, not just give advice. Seek diverse experiences and perspectives, and obviously find leaders who push you to grow, even when it's uncomfortable. So this is something that we do every single day. And I tell people, don't take this, things personally. I'm very critical of a lot of things, and opening yourself to, I don't know, embrace criticism and feedback is something that definitely helps you be better every single day. And I always tell people, you need to sort of like measure yourself daily. So you have KPIs per day, not per week or per month or per year. You need to be a better version of yourself every single day that passes.
That's a handful, Maria, and thank you. So now you're my honest definition of when I hear people talk about there are speed bumps, they're not necessarily
Mm,
roadblocks. And so that's exactly what you demonstrated through your career. And I guess your mentorship is a little good because you got some folks being hired away from you in under a year.
I
So
know.
kudos. But I mean, I know it's a pull employ. It's kudos to you though, because you got them ready to go. So give yourself
Yeah.
a hand for that.